Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. Now sinusitis is a term used for an infection happening inside the sinuses that are sitting in the face around the nasal cavity. Now like any organ getting infected, say for tonsil infection we call it tonsillitis. So similarly sinus infection is called sinusitis. Now the hallmark of sinusitis is that there will be headaches. A simple cold does not usually end up with any headache. You may have a little heaviness in the head because of the congestion, but a proper headache is a hallmark of sinusitis. Now a common cold or infective otherwise can spread into the sinuses, which starts as a simple cold can become a sinusitis eventually if you do not get it treated sufficiently. Otherwise it remains a cold and then it goes away. Sinusitis on the other hand will typically have a headache like I said before, and the headaches are more severe as you wake up in the morning. The congestion, the headaches are more severe in the morning, and as the day progresses the congestion comes down, the sinus headache also will ease off. In an acute infection you start developing headaches all of a sudden. Probably you have had a cold in the recent time and along with that the headache started and it is kind of getting worse and worse. Whereas on the other hand a chronic sinus headache typically starts very insidiously, very slowly it progresses because the inflammatory changes are going on slowly and the headaches will start appearing slowly. Again typically in the morning you have a light headache when you get up, and then as the day progresses the headache eases off. The next day or the day after again the headache comes in, eases off, like that. And as the headache or the sinusitis worsens, the headaches will become more severe and noticeable and more frequent also. So you start getting early morning headaches every day, every other day, then you should probably get it checked. Chronic sinus infection or chronic sinusitis as we call will lead to obviously frequent headaches, typically early morning headaches, which will slowly ease off as the day progresses, right. If you have more than 2 or 3 episodes in a week, then it means that, and for a long time, chronic means on a long term, at least 6 weeks of repeated headaches happening. And besides the headache, there is bound to be some inflammatory changes happening in the nose, which will lead to some nose block, some nasal discharge, even post-nasal drip for that matter, right. And if the infection progresses or if it becomes secondary infected acutely, then you will have sudden worsening of the pain, sudden swelling around the face. Sometimes if this infection spreads to the nearby structures like the eyeballs, you will see eyeballs swelling up and becoming reddish and watering, all those things. That means it is kind of extending into the areas other than the sinuses. Antibiotics do form one of the main treatment for sinusitis. However, if we feel that the infection is not very severe or the sinus congestion can be released by decongestants, the opening of the sinuses into the nostrils can be cleared without having to use antibiotics, we would definitely go without antibiotics. But maybe 24-48 hours of non-antibiotic treatment hasn't worked, or the symptoms are worsening, other symptoms like fever are coming up, then I think it is better to go for antibiotics in that situation. But definitely try non-antibiotic medications like decongestants and anti-inflammatory, nasal drops, steam, all those things can be tried before thinking of antibiotics as a choice. Yes, for the simple reason that the sinuses are situated in the face and the head region, right. So the one set of sinuses in the forehead, one set of sinuses in the cheek, and another set of sinuses between the eyes till about half of the head. There are multiple chambers which are sinuses, right. So when there is an infection, depending on which sinus is infected, the pain can be localized. If you have the forehead sinus infected, you have pain in the foreheads, right. Around the eyeballs you will have, if you have these sinuses are infected. If you have cheek sinuses infected, you will have facial pain. Some of these frontmost sinuses can also cause facial pain, right. Depending on the sinus which is infected, the headache and facial pain can be localized, especially in an acute setting.